When it comes to heart disease, early detection can be life-saving.
And one of those potentially life-saving tools can uncover signs something is wrong, sometimes even before symptoms appear. The test is called a coronary calcium scan, and it uses X-rays to detect and measure calcium deposits in the coronary arteries, which are the blood vessels supplying blood to the heart. The scan scores from 0 up into the thousands. The higher the score, the greater the risk of having a heart attack.
Reporter Kim Clark shows us what happened after one woman was nudged to take time out to find out her score.
St. Francis Hospital-Bartlett Administrative Offices.
Carol Harris, executive assistant to the CEO of St. Francis Hospital-Bartlett, is usually on the go.
It's very, very busy, you know.
While on one of her jaunts through the hospital, she ran into the chairman of cardiology, Dr. Muhammad Janjua. Pretty common since they've worked together for the last 10 years, but this time the doctor noticed something off.
She told me that when she walked from her office to the cafeteria, by the time she reached there, she noticed that she's short of breath, her heart is racing, and some chest discomfort which she was not able to describe much, and wheezing at the same time.
Carol, a relatively fit woman in her early 60s, blamed her symptoms on an earlier bout of bronchitis and put off Dr. Janjua's suggestion that she take a stress test.
So he knew how busy I was, that I wasn't going to take a half a day and do a stress test. So he said, how about a coronary calcium score?
After about a month of cajoling by Dr. Janjua, Carol finally agreed to take a 10-minute non-invasive coronary calcium scan, which measures the calcium buildup in her coronary arteries. Well, Carol's score in that scan was 676. Normal is 0. Well, that convinced Carol it was time to finally take that stress test, which she took and failed. The following day, Dr. Janjua placed 2 stents in her arteries.
And he was looking at the blockage, and I had 99% blockage in my main, what they call the widowmaker artery, and I had 85% blockage in the other artery.
The stents worked in the short term, but within 2 months, Carol needed double bypass surgery.
It was September the 24th when I had my surgery. On January the 3rd, I was able to turn back to work full time.
Carol says she was in the right place at the right time, blessed to work at a hospital where a doctor spotted her symptoms on site, because many women have no idea they too could be on the precipice of heart attack or failure.
Their symptoms are majority of the time shortness of breath, extreme fatigue, tiredness, racing heart rate, mild chest discomfort or jaw pain. So if somebody is above age 45 or above or having any risk factors, including like family history, are they diabetic, smoking history, high blood pressure, they should do a screening test.
Dr. Janjua says the majority of hospitals have coronary calcium scoring available. Any score higher than 400 is abnormal, and you should see a doctor immediately.
So it's a wake-up call, you know, to not have any symptoms except for a little shortness of breath that I associated with just running around, that the heart disease truly is, now I know, a silent killer in women.
According to the American Heart Association, a coronary calcium scan isn't always covered by insurance. It can range in cost from about $100 to $400.